Well, Pfizer could be paving the way for the next round of COVID vaccinations, this time for Americans ages 5 through 11. We know this could impact a lot of families here in central Indiana and all over the country. We're hearing from pediatricians who say they're hopeful about the next phase of this vaccine rollout.
The newly released data from Pfizer comes as schools are in full swing and pediatric cases are soaring.
As a pediatrician and a parent myself, we've been eagerly awaiting news about a vaccine for our younger kiddos.
Dr. Suzanne Grannon is the pediatric medical director for Community Health Network. She says a vaccine for younger age groups could give doctors another tool to fight this virus and its contagious variants. Right now, data shows pediatric COVID cases have jumped 240% since July.
With the start of school, it was pretty chaotic, and the best advice I could offer to parents was, get your vaccine for yourselves, because that surrounds your kids with vaccinated adults, and have them wear masks indoors.
But now kids could have another form of protection. So let's take a look at this trial. To start, the FDA asked for 6 months of follow-up safety data instead of the 2 months it asked for with adults. It also asked Pfizer to double the number of kids in its trials between the ages of 5 and 11. And keep in mind, this isn't the same dose that adults get. The trial uses 10 micrograms instead of 30.
And what they were trying to determine was the optimal amount to have the same immune response with a minimal amount of side effects.
The hope is to have this vaccine ready for kids by Halloween. Dr. Grannon says some parents are eager while others plan to wait. Either way, she says families should talk to their doctor if they have concerns or questions.
For a vaccine to get a green light, there are steps that a company has to go through. They put their vaccines through multiple phases of trials to gather data to share with federal regulators. After getting emergency use authorization, those studies then expand to include real-world data. An FDA committee reviews information for the agency to approve, and another independent group reviews the safety and efficacy information so the CDC can issue its guidance. Once it goes through both the FDA and CDC, then it can be given to the public.
Well, a recent poll from the Kaiser Family Foundation revealed about a quarter of parents with kids between the ages of 5 and 11 would vaccinate them immediately after emergency approval. But about 4 in 10 wanted to wait and see how the vaccine worked. We spoke to one mom who said there's just too much at stake. That's why as soon as she can, Victoria Barrett will be making appointments to get her sons, Finn and Ewan, 6 and 5, the Pfizer vaccine.
I am ready, and they are ready. So we're ready.
I've always believed in vaccination and medicine for my children, and to me, this is not different.
Now, both of those moms say that some of the worries surrounding their kids' safety will be lifted. Both say they've seen the vaccine work and prevent deaths.